Mm-hmm.
Now, it might surprise you that some of our best patients are actually the ones who start off really scared at coming, really anxious. I've had patients who literally have cried before coming into the rooms to just even discuss their mouths before we've even looked in. And we look back a year or two later, and sometimes we have a hug when we realize how far we've come. With these patients, we've maybe used some of our techniques, like we can do intravenous sedation. We have an anaesthetist who comes and does that for us, or for the really anxious patients. So what that means to them is that they can have their treatment with absolutely no memory of it and without feeling anything at the time. And it just lets them offload their fears, get dentally fit quickly. And these patients, by and large, don't need that again. They then become quite confident at just seeing things done in the normal way. It's miraculous. We also have some patients who still have their anxieties and their fears, and they continue to have occasional sedation sessions, even for cleans. Cleans can sometimes be sensitive, and they just go, you know what? I don't want to remember it. I don't want to feel it. So let's just have the sedation. Most people, however, we have other ways of dealing with their anxieties. So for instance, I'm sort of going backwards from, the biggest approach, using IV sedation, going backwards. Some people might want just a tablet to relax them, and we can provide that and discuss how best to use it to get a good night's sleep the night before. And what works really well on kids to reduce their anxieties is happy gas. I mean, it's almost no side effects, it's quickly out the system, gives them a don't care factor. They can relax and watch cartoons on our overhead TVs and generally have a really good experience instead of those bad experiences that so many adults come in talking about from the past.
Excellent.